And we are live. It's Dr. J here. Hope everyone is having a fabulous Friday. Let's dive in. So today's topic is going to be brain inflammation, brain fog, and depression. Really important. So number one, majority of serotonin is actually going to be made in your gut. Really important. A lot of these serotonin SSRI medications are actually shown to have more of an effect on serotonin in the gut than actually in the brain. Many people don't know, but serotonin actually can't cross the blood-brain barrier, but a lot of the precursor nutrients like B6 and 5-HTP can. So really important. A couple of mechanisms here. So serotonin, it's in the gut. It helps with motility. You have a lot of amino acid building blocks like tryptophan and or 5-HTP, which can cross the blood-brain barrier and can convert into that feel-good brain chemical in the brain. That's really, really important. Serotonin converts to melatonin, which is also a sleep hormone, which helps you kind of relax your cortisol, chill out, repair, and recover. So number one, to improve brain health from a mood standpoint, depression, anxiety, as well as from a brain fog standpoint, we have to decrease inflammation. So we decrease inflammation in the gut first by cutting a lot of inflammatory foods out. The more inflammation we have in the gut, the more gut permeability we have. The more gut permeability we have, the more undigested lipopolysaccharides and bacteria and food allergens go undigested into the bloodstream and hyper-respond and hyper-stimulate the immune system. The more the immune system is stimulated, it's going to suck away resources. Essentially, it's going to take up a lot of energy from our body, allow us to feel more moody, tired, fatigued, and it potentially could cause us to have brain fog and mood issues, partly because the immune cells in the brain, the microglial cells, once activated, they can create inflammation in the brain and they can create that kind of brain fog and mood issues. So part of the way that antidepressants do work is going to be through serotonin in the gut. And part of the way we're going to get our mood better and our brain fog better is through getting inflammation curtailed in the gut. Now, some of the newer families of antidepressants that are coming out are specifically working on reducing inflammation in the brain. Now, the problem with medication is they always have side effects because medications primarily work by inhibiting or blocking various reuptake ports or enzyme pathways. So anytime you do that, you're going to have a side effect coming somewhere else. Some enzymes that help with mood in the brain, they may also help with recycling and healing of certain parts as well. So then, kind of like Vioxx in the early 2000s, you block that COX enzyme, the cyclooxygenase enzyme. That same enzyme was really important for healing the gut and the heart and the liver. So really important. Once you block one pathway over here, we can have a side effect on the other side of the fence, and that gets very easily ignored. So inflammation in the gut, we bring inflammation in the gut down. We have to also support gut bacteria. If we have inflammation in the gut because of a whole bunch of bad bacteria, and a whole bunch of low beneficial bacteria, how does reducing inflammation in the gut via medication actually fix that? It won't, because that inflammation in the gut's there because of some other cause, and just fixing it without addressing the cause up here is not going to get the lasting solution you need. So we have to look at gut bacterial balance, we have to look at SIBO, parasites, we have to look at infections, we have to look at food allergens, we have to look at just poor digestion. Many people are walking around very stressed. They're stimulating their sympathetic nervous system, and that is creating low enzyme environment, low hydrochloric acid environment, and that's making it very hard for them to digest and break down their foods. All of your brain chemicals come from protein. They all come from amino acids. Amino acids get converted into dopamine, serotonin, adrenaline, GABA. Also, a lot of key nutrients like B vitamins, especially B6 and folate and B12, are really important for methylating your brain chemicals as well as synthesizing, right? Folate and B12 are really important for methylation. B6 is important for methylation as well as synthesis of a lot of your brain chemicals. So medications are working on inflammation in the brain. They're working on increasing serotonin in the gut. We have to work on fixing the root cause of why these issues are there to begin with. So we focus on food allergens, poor digestion. We focus on infections. We focus on bacterial balance. We will use specific supplements to increase some of these nutrients so we can have better brain conversion and or neurotransmitter conversion. That's important. A lot of people aren't getting enough nutrition, enough vitamins and minerals, and these are really important for converting and making your brain chemicals. Also, magnesium is very important for helping with brain inflammation. Famous neurosurgeon Russell Blaylock found that his patients who had brain surgery, craniotomy, etc., healed and recovered much better with supplemental magnesium than his colleagues who did not use supplemental magnesium post-brain surgery. So, a lot of nutrients can be very helpful, and we know according to, I think it's the CDC, 50% of the population is deficient in magnesium. So certain nutrients you're going to, one, burn up when you eat refined processed food. And number two, we're just not getting them enough in our diet, whether it's from standard American diet, nutrient density, and or just poor soil quality. All right, hope that helps. So kind of moral of today's story, medications working, SSRI helping to improve serotonin in the gut. Serotonin in the gut does not cross the blood-brain barrier. Also, there's 400 times more serotonin in the gut than the brain. New medications are working on decreasing brain inflammation. We want to work on reducing the root cause of the brain inflammation: gut permeability, foods, poor digestion, infection, SIBO, low levels of good bacteria in relationship to high levels of bad bacteria, as well as just brain inflammation from gut inflammation. The more your gut's inflamed, the more you're going to be stimulating your immune system, because 80% of your immune cells live in the gut. All right, let's open it up for questions. Hope that was helpful for most people. What kind of potassium do I need for keto cramps? Potassium citrate is totally fine. What kind of gut infections need pharmaceutical antibiotics? It depends. Like E-histo is a pretty nasty one. It just depends. Most infections we can knock down herbally. It just depends on how well you do. So typically second and third time around, we may look at that. How many bowel movements would you consider normal per day? I would say at least 12 inches a day, whether it's a 112er or a 2.6er or a 3.4, just about 12 inches a day on average. Why do people with anorexia lose weight even if the body is not in ketosis? Well, there's three types of ketosis. There's ketosis because you're starving, right? That's going to be ketosis from a very, very low calorie diet. You will go into ketosis when you are starving, 100%. The problem is you're not getting enough protein as well, so you'll also scavenge up a whole bunch of muscle as well. There's nutritional ketosis, where you're getting enough calories and you're getting enough protein, but your carbohydrate levels are so low and your insulin levels are so low that you're starting to burn fat. That's number two. And then there's ketoacidosis from a very abnormally low insulin environment, like with type 1 diabetes. So if you're a type 1 diabetic and you don't get enough insulin, you'll see a very high level of ketosis, 10x above. And also you'll see it with people that are like, typically that's going to be it's type 1 diabetic that doesn't give themselves enough insulin or forgets to, or they have a pump that falls out. And you can easily go into a ketosis coma, where your ketones go so high and it lowers the pH of your blood, and then the enzyme systems in your body don't work and you go into a coma and die. That can be common if you aren't on top of your insulin. So in regards to your question, people with anorexia would be in ketosis. That's part of starvation. Absolutely. Because your body's freaking out. It's trying to find extra fuel sources, so it's going to go after lean tissue, and it's also going to go after stored fat, and it only can do stored fat. Part of going after stored fat, it has to break down a whole bunch of ketones to do that. Let me keep on hitting this. My thyroid levels are normal, but my thyroglobulin antibodies are really high. Why could this be, and what can I do to improve it? So in general, you have to follow an autoimmune template. You have to look at the gut. You have to look at the hormones. You have to look at selenium, CoQ10, magnesium, all those key important steps. I have a couple of podcasts on this topic. I have a book coming out on this topic, so take a look at those references at justinhealth.com. Dr. J, every time I drink a healthy caloric drink like a smoothie, I overdo it with the fats or proteins. I tend to get burning pain near my shoulder blades. Any idea what it may be? Yeah, it could be the fact that your gallbladder is not working well, and you may want to look at adding more enzymes and bile salts when you do that. Dr. J, I asked the wrong question for this episode. I was listening earlier, but got pulled away. Not sure if it was a different one. I think I answered it already. What's the best natural source of magnesium? There's a couple out there. Citrate's kind of your standard one. Glycinate and malate are going to be better, well absorbed. 3-8 crosses the blood-brain barrier. Magnesium sulfate from Epsom salts. Those are all pretty good options. What do you think about an IgG test for food intolerances? Are they reliable? Not the best. There's other immune reactions that are happening when you are sensitive to food. IgG is just one of them. Maybe worth testing it, but I'm not a huge fan of food allergy testing. What's your opinion on the shingles vaccine? My father, who's relatively healthy, wants to get one. I told him that I think if he keeps his immune system up, that it's not necessary. What's your opinion? Yeah, I agree. I'm not a huge fan of adult vaccinations because vaccines only just bump up the Th2 immune response. It's not really touching the Th1. The best natural passive immunity for shingles is actually hanging out with a kiddo that has chickenpox. Chickenpox gives passive immunity for shingles, which is great. For some people who are looking to gain weight without overtaking digestive system support, what food should I add in that are anti-inflammatory and low in volume? Well, it's going to depend upon how much exercise you're already doing, but you can just try to increase your calories and try to make more of those calories come from carbohydrates. Fiesta writes in, my 13-year-old daughter gets shady hands often. We asked her if she's shaky hands. And she says, no, what could be wrong with that? It could be blood sugar issues. If she's going hypoglycemic, there can be a lot of adrenaline produced to bring the blood sugar back up, and that could be creating some shaky issues. That'd be my first step, is look at blood sugar and then, magnesium and B vitamins and those kind of things. You could always run an adrenal test too, and just run a fasting or a functional glucose tolerance test as well. What are your thoughts on sulforaphane? Is that an essential nutrient that must be taken daily? I mean, you're going to get that in a lot of your cruciferous-rich vegetables, which are great. Can you talk about which of your GI Clear supplements? I think there are 6 that are best for general dysbiosis, fungal bacteria importance. In general, I like GI Clear 1 and 4 great because they have really good bacteria support as well. And then I'll give a lot of the higher dose oil of oregano when I see a lot of fungus too. That's GI Clear 5. Could low E. coli cause mood problems? Could low E. coli? Well, E. coli in general, if it's a pathological or like a hemorrhagic E. coli, it could definitely create gut stress, which could increase inflammation in the gut, and inflammation in the gut can create inflammation in the brain and thus create mood issues. So for sure. Mag citrate gives me diarrhea. Magnesium oxide makes my stool sticky. What do you think about mag glycinate? That's fine. Mag glycinate, malate, threonate are great, and they get absorbed better and cause less digestive distress. How do you treat fusobacterium? It just depends. That's not a huge bacterial issue. I'd want to make sure there's not other gut stressors going on besides that one. What do you think about an alkaline diet? A naturopath suggests making sure meats aren't too acidic, even drinking baking soda when not enough alkalizing food in my meal. That's a bad idea. Baking soda is going to be very alkaline, and it will shut down your body's ability to break down proteins and fats. I would just make sure you get good vegetables at each meal and a good healthy serving of protein. I'm not worried about pH from meals. I'm worried more about pH from just inflammation in your body from higher amounts of gluten, higher amounts of grains and sugar and refined carbohydrate and omega-6 junky refined vegetable oils. I'm not worried about the food as much. Just make sure you're getting a good consumption of vegetables in there, and you should be fine. Good fats and proteins, not a problem. Okay, excellent. What's your remedy to dissolve gallstones and gallbladder? Working efficiently and effectively. So 1, make sure you're able to digest and break down proteins and fats. We may add extra bile salts in. We may add things like milk thistle, phosphatidylcholine, taurine. I have a product I use called Liver Supreme that's very helpful. And we may cut out a lot of the more common gallbladder food allergens. Pork's one, chicken's one, onions one. There's a great article by Dr. Jonathan Wright all on gallbladder. And there's some good food allergens that are even paleo friendly that you have to cut out. I did a video on this topic, so just Google like Dr. J and gallbladder health. A lot of questions come in. I've already done a 10-minute video on a lot of these topics, so I'll refer you to my video versus having to redo the video here. About my question posted, it's with CKD stage 3. What's a good natural detoxification? What does CKD stage 3? Is that chronic kidney disease? Is that what you're referring to? Are we talking about humans or animals? Humans, ketogenic diet is going to be one of the best ways to naturally support that. We can also give things like astragalus and cordyceps, which are very good too. James right there, any supplements that prevent cold and keep the immune system strong this winter season? Yeah, I did a podcast on this recently and a video the last couple of years and a couple of blogs on it. So I'd refer those. But the big things I like is my Immuno Supreme product, which has a blend of different mushrooms and medicinal herbs. Some good things to look for are medicinal mushrooms like reishi and cordyceps are great. Also, astragalus is great, andrographis is great, echinacea root is great, golden seal is great. Those are really good ones. Monolaurin's great, silver's great. I've been using for like a sore throat. I knocked it out in like a day. I used some special herbs, biocidin spray, and that topically hits the back of my throat. So the herbs actually knock down that bacterial or viral load directly, which is pretty awesome. Okay, but I got a great article on it, James, called What to Do When You Get Sick, Part 1 and Part 2. Take a look at that. Delty writes in, I feel that L-theanine supplements make me more anxious than calm. Is that normal? What other calming supplements for anxiety do you recommend? Ashwagandha, and you could always do GABA and magnesium. What does low zonulin basically mean? I'm not sure if there's a meaning for low zonulin. Histamine measurement in the stool or blood better? I would probably do it in the urine because you get a better window. But you could do blood as well. Blood or urine. Matthew writes in, my friend's poop are usually big, firm, and once in the morning. Last 6 months, 6-inch small, soft, skinny little ones. They don't float. Normal, whole food, vegan ideas. Not sure. So, I mean, off the bat, I'm not sure really what she's eating, what kind of a diet he or she is eating. Also, is there enough enzymes or acids or digestive support? Just sometimes getting enough digestive support really changes how that stool comes out. So I would look at that first. Excellent. What causes watery eyes, mucus, and flames during and after eating most foods? It could be just food allergens, honestly. It could be food allergens, gut inflammation. Holly writes in, best protocol for diverticulitis. Doctor keeps giving antibiotics to my relatives. I would start on a really good paleo or autoimmune diet, and I'd work on good probiotics and anti-inflammatory amino acids like glutamine, aloe, DGL to calm things down. Start from there and keep a lot of the nuts and seeds out in the meantime. How many days in advance should one do a stool test supplement before a GI map? Typically, you can do it. Should one stool, so I'm not sure what kind of supplements you're referring to, but typically you can just take supplements while you're doing the stool test. Cassie writes in, on a Broken Brain podcast, Dr. Kiran Krishnan says coconut products contribute to leaky gut. What's the deal here? I thought the opposite. I'm not sure what the mechanism is. I mean, just saying something causes something doesn't mean anything to me. We know certain food allergens like gluten and casein can be contributing to leaky gut. I'm not sure there's a mechanism for coconut, as it's mostly good, healthy fatty acids that have a lot of literature of being anti-inflammatory and very helpful on the body. So I'm not sure there's any mechanism present there. Hold on one sec. Come on. Come on. Come on. Come on in. That's my cat there. He wants to come back into my office. All right. My wife and my 13-year-old daughter get sweaty hands often. What is causing this and how to fix it? It could be from adrenaline. It could be from a cortisol surge. You want to get your cortisol and adrenaline levels checked and looked at. Redmond real salt does not have iodide in it. Is that a problem? Nope. No, I typically don't like to give a whole bunch of iodide to people off the bat because they could have Hashimoto's and that could flare up their autoimmunity. Can you talk about undereating and its effects on the gut and the adrenals, blood sugar swings? Yeah, not getting enough proteins, fats, and healthy carbs, or just enough calories can be a stressor on the body for sure. It definitely can be. So getting enough calories is important. Akbar writes in, what is a gastrodoc's solution to food reactions to a lot of food that makes life miserable? One sec. Come on, Dexter. Come on. Come on. Come on. All right, we're good. Hey, Dexter, say hi. Hi, Dexter. All right, we're good. Cat problem completed. So regarding the 13-year-old girl, sweaty hands, yeah, adrenaline, cortisol, those are going to be the big factors there. Should you be concerned about free T3 of 2.2? Yeah, that's very low. Excited that my TPO antibodies are down from the 50s. T3 free 2.2, T4 free 1.4, thyroglobulin less than 1, TPO antibodies low as well. Yeah, so T3 free, there's definitely a T4 to T3 thyroid conversion issue going on there, 100%. So that needs to be looked at. What's a gastrodoc solution to food reactions? Most don't even address food reactions unless it's like a celiac disease and there's like a ton of gut inflammation and you see the villus atrophy. Outside of that, in gastrodoc world, most do not, like food allergens don't even exist. Don't even exist. All right, excellent. Any other issues so far? So anytime you undereat and you don't get enough nutrition or calories, that's a stressor on your body. Especially if you get too much carbs or too little calories, that you're getting nutrition in when you get calories, if it's whole food. So if you undereat nutrition, then you don't have enough nutrients to run your body systems, and that creates a stressor. It's like not making enough money for the bills that are coming in as well. Yeah, and Dexter has kidney disease too, but I take care of him. He gets a low phosphorus diet. He gets about 30% protein versus 40 or 50. He gets cordyceps and astragalus and a couple other herbs and some kidney glandular tissue, and he's doing good. He's rocking it pretty well. Any tips for cause and ridding keratosis pilaris in toddlers? So typically that's going to be essential fatty acid issue. So I would look at getting high quality omega-3s on board. I'd work on getting extra minerals like zinc on board, and I would look at maybe digestive support as well, at least some enzymes, and start there. All right, excellent. All right, any other questions, y'all? Let me know. Today was great. Very good chats today. I'm going to be back in just a few minutes on a live podcast here, which I'm really excited about. So feel free and tune back in, and we'll get some amazing more information out to you. Last question from Tatum. Is it possible to get too much coenzyme and B complex and methylcobalamin to cause gas? Maybe. It depends what else is in that product. Depends on the fillers. And you would just kind of start one at a time and taper up and see if that is the case. All right, guys, phenomenal chatting with y'all. You have an amazing day. We'll talk soon. Take care.